Open the Atlas of the Human Body to page 52. Let's cover some basic information about your skeletal system. We have long bones. If you look at the picture in your atlas, you can visually see that these are the longest bones in the body. Some examples are the humerus, which is your upper arm, radius and ulna, which are your lower arm bones, your femur, which is your thigh bone, your tibia and fibula, which are your lower leg bones. Short bones. Some examples are phalanges, which are your finger and toe bones, your metacarpals and your metatarsals, which if you're coming up your hand, your phalanges are your fingers, the palm, those are your metacarpal bones, and in your foot, it's your metatarsal bones. Your clavicle is your collarbone. Flat bones. Example, you have your sternum. There's the middle of the chest. It's very flat. Your ribs, even though they're curved, they're also flat. Irregular bones. Some examples. Your ilium, even though it's concaved. Your coccyx, which is the tailbone, and definitely the spine. You can see how those are very irregular bones. Compact bone. Bones that are strong, such as your leg bone. You have fibers that are pressed tightly together to make it as strong as possible. When you think about a blacksmith, they take one piece of metal or steel, they heat it, they get another piece of steel, put it together, heat it, and press it together. And they continue to do that until the sword is extremely strong. It's the same as your bone. You just want to make sure that you visualize everything as we go along. Visualization is the best way to remember the terms. Joints. Bendable tissue connection between two bones. Ligaments. Fibrous connective tissue that connects the bones to the joints. And tendons. Fibrous connective tissue that connects the muscle to the bone. Now let's look at the upper extremities. You have your clavicle, which is the collarbone. Acromion, which is the end of the scapula and clavicle. AC joints, which is the joint between the acromion and clavicle. Scapula is the shoulder blade. Humerus, the long bone in the upper arm. The elbow is the olecranon or olecranon process. Ulna, long bone in the lower arm. When you think about taking vital signs, we always tell you that your pulse is taken on the thumb side. That's your radial pulse. The pinky side is your ulna. That's the ulnar pulse. Your pelvis. Well, let's back up. Ulna is the long bone on pinky side. Radius is the long bone thumb side. Your pelvis is your hip bone. Pubis is the groin bone. Then we have the lower extremities. Your tibia, lower leg bone, and fibula is your other lower leg bone. Your femur is your thigh bone. Patella is your knee. Calcaneus is your ankle. Now we're looking at labeling the lower facial bones. As a part of a limited medical x-ray, we cannot do skull x-rays. However, when you're x-raying the spine, the cervical spine, we have to make sure that we come up high enough to get C1. So we want to make sure that we come up as far as behind the ear. Okay? So let's look at the mandible, which is the lower jawbone. The mastoid process, which is behind the temporal bone. Zygomatic arch, cheekbones. The nasal bone, which is the nose. The maxilla, which is the lower jawbone. Now the spine. spine is called vertebra for singular, vertebrae is plural. In the medical field, if something ends in A, it's singular. If we want to make it plural, we add an E. The cervical spine. The first 7 are the cervical spine. So cervical spine, you have 7 spine. Thoracic, you have 12 vertebrae. Lumbar spine, you have 5. Sacrum, at birth, you have 5 vertebrae. But by puberty, you have either 1 or 2. Coccyx is your tailbone. Those are signified if you see that the doctor wants to evaluate C1 through C5. He wants to view the first cervical through the 5th cervical. You just want to make sure you go up high enough and down low enough to get all of the cervical spine that the physician wants to view. As we go through the Bontrager's, they give you perfect examples to make sure that you have landmarks, to make sure you go high enough to get the full view. And we'll cover that in detail. Now the chest. We have the AC joints, which is at the end of the clavicle. The scapula, which is the shoulder blade. The sternum, which is the middle of the chest. The clavicle, the collarbone. Thoracic portion of the spine. And then we have ribs.